Good morning, everybody. I really want to welcome everybody and thank you for coming this morning. We're really excited to be able to sponsor this Women's Health Kiosk that provides health information to women here at Mary Breckinridge Hospital. We're very grateful that Melly Noble, the administrator of the hospital, has agreed to have us place this here, and we're very grateful to the Kentucky Commission on Women for starting this program. So Frontier Nursing University is excited to partner with all of you in providing healthcare information to women of Leslie County. Thank you very much.
Thank you. Well, good morning, everybody. And my name is Eleanor Jordan, and I'm the Executive Director of the Kentucky Commission on Women. And I want to thank you all for attending today to celebrate this great partnership we have now between the Kentucky Commission on Women, Frontier Nursing University, and the Mary Breckinridge, and I was told to say ARH Hospital. Before I share some information about this health education project, I'd like to take a moment to, number one, thank Governor and Mrs. Beshear. They're both so supportive of what we're doing and of elevating the status of women in Kentucky, period. So their support makes it so much easier to do what we're doing at the Commission. I also want to tell you that if you haven't seen the Kentucky Women Remembered exhibit in the West Wing, where we're located, of the Capitol, there is a wonderful watercolor portrait of Mary Breckinridge. The Commission also gives two health awards, has given two health awards called the Mary Breckinridge Women's Health Awards. So we're very cognizant of the contributions that she made to the Commonwealth and to women. After a great deal of research on our own, after getting information from the Kentucky Women's Health Registry, the Division of Women's Health, and about 62 other clubs, organizations, agencies. We talked to advocates, we talked to folks in the trenches about women's health. And we were able to define one of the problems that we think exist in the Commonwealth, and that is that there is a population of women in our state who go to the doctor only when they get sick. Most of the time, these are women who have some kind of barrier. It could be they have lack of insurance, they have limited access, maybe it's trust, maybe there are some cultural challenges, maybe there's limited English proficiency, poverty, maybe they do seek care for themselves, but only after they've seen to their children's needs and their husband's needs. Maybe it's just plain old fear of the unknown. Well, the Commission on Women pondered the question, how do we get these women to become involved in their own health? How do we get them to be inquisitive about prevention and to take the first step into learning how to stay well rather than seeking instruction on what to do after they're sick? It's our last resort to hand them a pamphlet on one health subject and hope they'll read it and hope they'll follow up with a screening? Do we hope that they'll be able to access a website and read information? And what happens when we have no more money in the budget to give incentives to be screened, like gift cards or coupons? Well, there's an old adage that says, teach me and I may forget. Show me and I may remember, but involve me and I'll understand. The Kentucky Women's Wellness Guide Kiosk, we think, is a cost-effective, fun, and innovative way to teach and show, but more importantly, to help women involve themselves in their own health. The guides, as you can see, are bright and attractive to the eye. At least we think so. We like that color. They're easy to understand and they're easy to use. We know that women talk to and listen to each other about how they're feeling. So the users are greeted by a diverse group of women or girlfriends who share their own health story and the steps they took to begin determining and addressing their own health needs. The information is presented in a non-threatening manner designed to appeal to multiple learning styles and reading abilities. Users can hear questions that they themselves could ask a healthcare provider if they do decide to follow up. But the message they will hear over and over and over again as they're navigating the kiosk is take hold of your health today. They can use the telephone, which is programmed with some of the most utilized numbers for this area to connect them with immediate assistance. And there are numerous other additional Kentucky resources that are helpful. We use Kiosk all the time. We order tickets, we make flight reservations, we see them in museums, we use them in the mall to find out where we are. But using this very simple technology as a health education device, strategically placed where women can access them and comfortably navigate through menus of credible information and then locate assistance immediately, could prove to be one of the most innovative strategies that Kentucky can use to move behavior from a sick care mode to a well care mode. That's what saves lives, and that's what saves dollars. This kiosk will be updated using remote access if it needs to be, and the usage statistics will be maintained in a confidential database and available in report form on a regular basis to the sponsor, which is Frontier Nursing University and the Mary Breckinridge ARH Hospital via the Commission on Women. Our first women's wellness guide, our test guide, our pilot, so to speak, was placed at the Park Duval Community Health Center in West Louisville in January of last year. Our sponsor for that kiosk was the HIV/AIDS branch of the Cabinet for Health and Family Services. So our target population was low-income, medically underserved women of color, which is the fastest growing population of HIV/AIDS victims in Kentucky. Many women in this area, and I live in this area, seek medical care primarily when they're sick, but they don't engage much in preventive screenings. We place the kiosk in a waiting room visible to an area where people stand in a registration line. I'd like to share with you some of the usage statistics. In the first 6 months, there were 521 complete navigations from the screensaver through one or more of the modules of the Women's Wellness Guide in English. The Wellness Guide in Spanish was accessed 8 times. There were 66 instances where the telephone was utilized to make contact with one of the helpline numbers. The 5 main modules of interest were depression, weight management, asthma, HIV/AIDS, and domestic violence. To date, the Park Duval kiosk has generated a total of 1,487 complete navigations and 132 follow-up calls for help. The main modules of interest are the same as the first 6 months, except sexually transmitted diseases has now replaced domestic violence in the top 5. I also want to say, we don't necessarily think that those are 1,487 individual women, but we do believe they're coming back. Park Duval's Wellness Guide alone has not only reached, obviously, hundreds of women, but it's also giving us a profile of what the health challenges are in that particular area. The Women's Wellness Guide does more than teach and show. It involves women. They are taking the first step. They are becoming empowered with the knowledge to understand that I have to do this. I have to take hold of my health. Our aim with the help of continued financial partners like Frontier Nursing University is to strategically place these women's wellness guides at any place where our targeted population of women may be spending some length of time. Laundromats, low-end grocery stores, healthcare clinics, community centers, men's prison waiting rooms. The possibilities are just endless. So I want to again thank the Frontier Nursing University for embracing this project and the Mary Breckinridge ARH Hospital for being so accommodating to place a unit here. I also, in her absence, I want to thank Brittany Edwards, I want to thank Glenda McCoy, because they connected, and I think all of you know who run a department or run an agency, that there are these talented, just wonderful folks with a lot of institutional knowledge who get the job done and make people like me look good. So I can stand up here at the press conference. So I want to thank them in their Glenda in her absence, and for doing all of the hard work and seeing to the logistics. At this time, I'd like to bring up somebody who I always want to, we're like Batman and Robin, but they're men, so I don't want to say that, but Joy Hoskins is the director of the Division of Women's Health, and she is the Assistant Director of Nursing for the Kentucky Department of Public Health, and I always like to have her along when we place a women's kiosk, and she is always very accommodating and says, yes, I'll go. Joy?
It was such a lovely drive this morning to Hyden, to Leslie County. It's my first time here, and it's wonderful to see faces that I've and folks that I've known from my past. Julie is an acquaintance and a friend of ours with the Department for Public Health and the nursing office, and so thank you for having me here today. I wanted to acknowledge and recognize the partnership, and partnerships are what it's all about today, isn't it? Between Mary Breckinridge ARH Hospital, the Frontier Nursing University, and of course the Kentucky Commission on Women. In today's times, partnerships, particularly at the grassroots levels, is the way to provide resources and access to information and healthcare services for our all of our residents of our communities and of our state. As a nurse and with the Department for Public Health, I frequently receive calls and questions for assistance regarding resource information for healthcare, particularly for those women who may not have insurance. The bilingual kiosk will provide women with information on topics such as diabetes, asthma, cancer, weight management, heart health, and breast health. In addition, the kiosk modules will provide an innovative resource way to provide the information, contact information in their local communities to individuals regarding where they receive these preventive health services. Knowledge about one's health, particularly for women who are uninsured or who may not have access to other information, is an important step to one's health and well-being. On the way down, as I mentioned, I thought about Mary Breckinridge, and as a nurse, I know well the story of Mary Breckinridge and her traveling through Hyden and Leslie County on a horse, and I was there in my van with my iPhone at my side and my Diet Coke and in my car, and I thought, my goodness, how far we've come with our technology and our resources and reaching out to our residents, and wouldn't Mary Breckinridge be proud of us? So thank you for your partnership and your engagement in reaching out to women, and for all that you do for our citizens of Kentucky. Thank you.